hey, if they hit a plateau some way, if they're not moving along as expected, I always tell people that's the time when we have to gather more information.
Patients are able to come in and we're able to walk them through anything from an acute episode of back pain or adhesive capsulitis. You're able to correlate whatever you're finding to what they need to make them stronger, as opposed to a cookie cutter, here's an adjustment, here's some stim, maybe an ice pack, heat, a roller table, and then they're out the door.
Hello, everyone, and welcome to Polish Your Life Doctors Networking Group. Today, we're going to talk about chiropractors, and we're going to talk about chiropractors because many people don't know what chiropractors actually do and how they collaborate with medical doctors to achieve the best clinical outcomes for patients through something that we call integrative medicine approach. And today I'm here with amazing guests. I'm here with one of the hosts, which is Dr. Todd Johnsonbaugh, chiropractor in Columbia, Maryland. And I'm here also with Dr. Neuer, who is a chiropractor in Hanover, Maryland. We're going to have a very good conversation about what chiropractors actually do and how that integrative medicine may work for your benefit. And for those of you watching us for the first time, I want to let you know that we are a group where healthcare providers collaborate. And we invite not only healthcare providers to collaborate with us, but also individuals who are looking for clinical solutions. So whether you're a provider, individual, feel free to join us on Facebook. We're going to be going live every Thursday at 8 p.m. So today, Dr. Todd and Dr. Neuer, let's talk about chiropractic and let's talk about what chiropractors actually do. Maybe Dr. Todd, if you can let us know the basics of, why do people go to a chiropractor?
Well, chiropractic has been around for over 100 years now. And some type of, chiropractic means done by hands. And chiropractic prides itself on treating almost all the joints in your body and conditions associated with the joints. But Steve, would you say that Dr. Neuer, would you say the number one thing that brings people into chiropractors, or the top things I noticed, would be things associated with the lower back symptoms, neck symptoms, and upper back symptoms, and then finally headaches and symptoms associated with that. I say that's the top three things that start off with chiropractic. And that from there, we build a base and educate people about all the wonderful joints and all the wonderful ligaments that attach to there. Take it away, Dr. Neuer.
Yeah, so generally what ends up happening is somebody will find us because they've had back pain, neck pain, some sort of headache. And generally there's a conversation with that particular individual and they'll talk about my shoulder's been bothering me, or their plantar fasciitis has been acting up. Or they bring up, hey, do you know anybody that may help with migraines because my significant other gets them? So generally, it's one of those interactions that you end up telling them and informing them that not only do we deal with just these three primary incidents or three primary conditions, you generally tell people that you can help with headaches, migraines, adhesive capsulitis, tennis elbow, carpal tunnel, plantar fasciitis, et cetera, et cetera. So usually what ends up happening is you can kind of inform one person, it becomes two, it becomes three, it becomes four. And it's probably once every other week or so that I'll get a patient who will tell me, I had no idea you guys treated this. So.
Yeah, it's pretty amazing, Mike, the number of things that we treat. And when you take a fairly a holistic body approach, and we start when we analyze people to even just begin care, we a lot of times take a look at their posture. And in their posture, you start to get valuable cues. Even when they walk in from the parking lot, a lot of times I can spot. Dr. Neuer, can you spot people as they come into your office from how you all are situated or not?
Yeah, and I do make it a point, which I think is where you're going with it, is to try to get my eyes on the patient before they know you're watching so they don't change anything.
Right. So then you start to notice things like how they walk, and then how they stand, how they get up from sitting, how they turn their head when they're moving and talking with you in conversation. All those little cues give you cues about how they're feeling, and you can ask questions, and that creates that dialogue. And from that dialogue, patients invite you into all of their symptoms. But I think that's the most valuable thing for any practitioner out there and any patient to feel, is you feel like you have a dialogue. And I think chiropractors, because we have to apply pressure, and the patient has to relax to accept that pressure in order to have a really successful adjustment. I think because we know that from the start, we're always creating an environment from which an adjustment can happen. And when that adjustment, by creating that environment, we also create an environment from where people can share more. And when people share more, like you said, Dr. Neuer, they just start to go, hey, can you fix the bursitis in my left hip? Or like you were saying, that frozen shoulder, that adhesive capsulitis, can you fix that? And before long, they start to piece it together. And this beginning thought becomes a growing hope.
And maybe
Exactly.
Dr. Neuer, if you can talk about chiropractic adjustment, right? Because we all like to we think about chiropractic doctors as that place that you go and you get adjusted. And some people think that you're actually cracking the bones. And I want to tell people who may not know what it is, what that process is, why you adjust people, and what that adjustment actually is. And maybe you can touch on the sound, like why do people hear that popping sound? Because that's also interesting and entertaining for some people too.
Yeah, and you also get graded on it. So you try to find people that sound really good when you're in school. So they pop, so you get a passing grade. So I actually just did a post on this from an article that is probably 3 or 4 years old. So the popping sound is actually, this is a bit geeky, so people may pass out on this, but the fancy word is called tribonucleation. So it's actually the formation of a gas bubble. So you have two spaces in the joint surfaces that open with the force when you adjust it, and you get that noise. And it's actually the formation of a gas bubble. It used to be, it was the can of pop analogy where you release it, but it's actually, they recorded it for that. So anybody who's geeky out there, you can look up what tribonucleation is in physics. The other thing that it does is there's a couple proposed mechanisms behind it, but definitely the one thing that it does do is it does interact with the opioid system in the brain, and it reduces people's pain. What is great about that is it gives you a therapeutic window. If someone comes in with pain, they generally can't move as well as they once as they could. So when you adjust them, you do some soft tissue work like Graston or ART, dry needling, whichever therapies people use. When you use that with others, you end up giving them the better opportunity to do maybe more pain-free movement and have a better rehab session. So they actually leave with a better range of motion, but they also leave with less pain. So it's a great way to incorporate one piece of the puzzle that we're known for. The other thing that I thought was interesting, and Dr. Todd probably has seen the same thing happen, is we're not the only ones that have the authority to adjust anymore. So I run into patients all the time that say, hey, I went to a PT and they adjusted my back, or they went to a DO and they adjusted my back. So I think it's becoming a little bit more well-known, but I'm sure Dr. Todd can kind of tell me some of his experiences with that.
I remember a lot of people would say, yeah, I was hurt by an adjustment. And I go, oh, what chiropractor did that? They go, no, I was at a party and people were just adjusting each other. It was a big thing in California. It was like, oh, so we got to make sure, when you're getting adjusted, please make sure a licensed professional can do that. And also, Dr. Nori, do you notice that you do like different levels of adjustment? Like obviously how we adjust, let's say, a toddler that hurt themselves, like just walking and bump their head, might be a lot different than how you would adjust a rugby player. So speak to how the adjustments can change based on the patient.
Yeah, so people who are generally hesitant, I won't jump in and do an aggressive manipulation.
Right.
Oftentimes, I won't even adjust that area on the first or second visit, just to kind of reinforce that we're not going to do anything they're not comfortable with. But there are what they call grades. So you can do the top one, which is a grade 5 manipulation where everything pops and you do a thrust, or you can go all the way down to just a 1, which is just a very light pressure and with a range of motion. So you don't have to jump in with an aggressive manipulation right out of the get-go. You can actually move into these things with just light mobilizations. Sometimes you don't even have to get to that point, especially someone with headaches. If they're really concerned with, I don't want my neck adjusted, I don't want my neck adjusted, you can work with mobilizations as well, just some light pressure and some range of motion. You still get the same therapeutic effect. You just don't have to necessarily adjust them.
Mike, I think that's a big point because a lot of people don't think about chiropractic they think about it as all or nothing. A lot of times it's the cracking or that's it. And, you know, I even had a person come in one time, and I don't know if you guys ever watch any like Titan release the, you know, Emperor, but they go, release the Kraken. And I go, well, we don't have to necessarily do that sometimes. Sometimes we do, just like you were talking about, Dr. Neuer, the mobilization part. So mobilization is what is very valuable for chiropractic, and we do it a lot. And it works really well with those hesitant patients. It also works well with our patients that come in from medical referrals. I remember meeting a doctor years ago, and he said, Todd, I'm hesitant about my patients receiving neck adjustments. I said, hey, no problem. We'll work with them where they're at. We'll just mobilize them. And he was getting ready for a big counter argument. It was like, okay, great. I'll start sending them all over to you. And just that simple validation, and we still got great results. And then over time, sometimes people would just do a gentle stretch, and all of a sudden they would have this big, give me the word again, Doc, not the cavitation,
oh, it's the fancy word, tribonucleation.
Yeah, that awesome word. Mike, you should have that pop up below the screen there. That would happen there. And that was all. And then that would happen. And the patient would feel very calm and at ease. So we work in, you know, a good chiropractor is going to make the patient feel comfortable at all times.
Yeah, let's also talk about, you mentioned referrals from medical doctors. I want to also touch on the fact that you as a profession, especially, and it's probably the same with every profession, you have the better ones, you have the average ones, and you have ones that really don't represent the profession too well. But for the good ones, I've watched you, Dr. Todd, for so many years interact with patients, and I see that the evaluation process, not only at the beginning, but even throughout the care, is very deep. And you not only ask questions, you watch them perform, you ask what they did at home, you give them assignments, and based on what's going on, many times you're going to also give them a referral to additional modalities to other providers. So sometimes that dialogue is not only between the doctor, the chiropractor, and the patient, but the dialogue is between providers on a specific subject that the patient may need additional support. So I want people, in the context of our group and the collaboration between providers, I want people to know that chiropractors are probably the most open profession for collaboration, because they are kind of like the gatekeepers sometimes, in addition to the primary care physicians. And then when they find out what is going on with the patient, and sometimes patients, because you help them with things that they may consider a miracle, like migraines they've been trained to deal with, and they were dealing with and trying to fix for 10 years. Right now they feel better. They will ask you about X, Y, and Z, which may be beyond what you can help them with. And that's where the referrals and communication comes in. So maybe Dr. Neuer, you can talk about it. We just spoke on the phone about this subject. Talk about the level of collaboration, the enjoyment of that process from a provider perspective, and also the results for patients.
Yeah, absolutely. So I'm making a note so I don't get myself off track. So I think one of the great examples are acute patients. So someone came, actually, ironically, I just did this today. Somebody called, asked if I would see them. I generally don't see any patients on Thursday. It's more of an admin day on the backside, but it was an emergency appointment. So I met the guy, back spasms, he was antalgic. I watched him get out of his car. I almost went out to help him because I felt terrible because I couldn't get to him in time to help him out, but he was in severe pain. So a lot of these patients, what I really like doing, if they have a primary care doc, is I will reach out to their primary care doc after I treat them, because sometimes you really have a patient who's so inflamed that really just teaching them some spinal hygiene and some bracing techniques of just how not to make it worse, and then reassess with them in the next day or the day after. I like to work with their primary cares and try to see if I can get them a medral dose pack or some sort of corticosteroid step down when they're in so much pain that they literally can't function. That's one of my things that I like to do. And then if I'm working with that patient, and let's say that all of the therapies that I'm doing are not effective, and I'm thinking this is a really bad disc herniation, then I usually will order an MRI and send them over to a ortho that I work with so that they have everything with them. So instead of going to the orthopedist and then going to an MRI and then coming back, and then sometimes you're 3, 4, 5, 6 weeks at that point, being a portal entry provider, it actually, you can set up patients for success. I also do some things with some weight loss, but I'm curious with Dr. Todd how he approaches it with the disciplinary approach.
Yeah, I just think every time you talk to somebody, it's an opportunity. I remember early on, I used to think I was a little bit more shy, I guess, as a junior chiropractor. But now I just think every opportunity for a conversation is an opportunity to help people further. So it is amazing as you continue to try to get people more comfortable with the treatment. And Mike, you point out, I think a good chiropractor probably assesses or reassesses almost constantly. Wouldn't you say, Dr. Neuer? Like you're almost, yeah, I really feel like the assessment happens pretty much every visit.
Absolutely. You're always asking, yeah, I mean, worse, better, same. Are you moving easier? What was painful? Is it not as painful? I mean, you're asking these questions every visit.
Yeah. And a kind of a guideline, if chiropractic is working well for you, is the treatment itself should look a little different from session to session. Yes, it's going to have a certain format. Maybe you have some warm-up exercises, maybe then get a treatment, maybe some muscle work first and then receive the treatment. It might have a certain flow, but that treatment itself can change. If you're saying I'm receiving the same adjustment time and time again without an assessment, well, that's kind of a red flag. And with those assessments comes the opportunity for, hey, if they hit a plateau some way, if they're not moving along as expected, I always tell people that's the time when we have to gather more information. And when we gather more information, that's either, hey, refer directly for imaging, like you said, Doc, with MRIs, or, hey, nerve assessments for nerve conduction tests, things like that. Or we need additional assessment to make sure there's something not sending pain to the spine. So let's say somebody has pain in right between their shoulder blades. Well, a lot of times that's the pain referral pattern for the stomach and the esophagus. So we say, hey, let's think about it. Let's think about gastroenterologist. I remember one time I had a patient with shoulder blade pain, young, 16, and it kept coming back after about 3 adjustments. It kept coming back. And I said, I want you to go ahead and get checked for mono, please. And then they came back another week later or a couple of weeks later after it resolved. They, how did you even think of that? And I go, well, the spleen is noted to refer to this area. And it kept coming back to that area. And I expect if I'm on point with my adjustments, they should continue. And that sometimes happens with low back adjustments. We all of a sudden see L4, L5 come back out of place. And again, we go, oh, hey guys, please get your prostate. The first place they can refer sometimes is to the low back. So Doc, you could speak to this, but a lot of times chiropractors are the ones that help lead to those more serious diagnoses also, if the chiropractor is on with it.
Yeah, going exactly to what you were talking about is a lot of times we are unfortunately the first ones to let patients just tell us their story. I can't remember the time frame anymore. I think it's the first 2 or 3 minutes. If you let a patient just talk, they'll tell you exactly what's wrong with them. So if you just sit back and just kind of listen and just let them have the floor, they will generally give you enough information that you don't have to ask too many more things to not be in the right ballpark. But this particular individual, he came in with pain right in his glute. He thought it was piriformis syndrome because he had it prior on the opposite side. And he kept telling me what he was doing. He'd been to like 2 or 3 PTs and 1 or 2 chiros. And he gave me that nobody can figure it out, you're my last person kind of speech, which I'm sure Dr. Todd has gotten as well. So he said he specifically looked me up because he wanted dry needling. And I said, okay. So did my thing. I found what he was talking about. And I went back and I looked and there was just this massive lump sitting right where he was talking about. And I said, this isn't normal. Like, you can generally put enough hands on enough bodies and go trigger point, tightness, whichever. I said, I'm not needling it, but I do want you to call your primary care doc. Like right now, if you don't, I will. And I actually went out and called. So fast forward, ended up being a sacral osteosarcoma, I believe. And he was referred out and I never talked to him. I never spoke to him again. And about 18 months later, he came into the office for neck pain. And I just kind of immediately stopped and pointed and I said his name and he's like, "You remember me?" And I was like, yes, how are you? Fill me in, please. So I'm sure every chiro after so many years and so many clinicians after so many years do have some sort of story that ends up being like that.
This is amazing, really amazing. I wanted to also bring up one story that I was a witness of, and that was that just gives me chills, because when we were doing, I was assisting in the process of evaluation, and then I was seeing the doctor review the x-rays, and then there was something on the x-ray that looked like it's a calcified aorta, and the patient had no idea. So the patient finds out from a chiropractor who was checking their back from the x-ray. The first most important message they get is, "I want you to see your cardiologist right away, make an appointment." And it's possible that we are able to save, as an office, we are able to save somebody's life, possibly because they just had no idea, and they suddenly go to a cardiologist to confirm it, and they can react as quickly as possible. So coming back to the topic, I want people to know that chiropractors may be known for cracking your back, for back pain, for neck pain, for headaches, but there is a lot more. So we talked about evaluation, we talked about having that guidance in healthcare, that you can also guide people to different physicians. You can also be a complementary service with physical therapy, and even perform physical therapy, because that's something that a lot of people don't realize. At Dubs Rehab, for example, where Dr. Todd is, there is a separate physical therapy department, which is very comfortable because you have all the exercises and rehab in the same place. But even if there is not, chiropractors in Maryland have physical therapy privileges, so they can do physical therapy modalities that are also helping make the body stronger and hold the adjustments, and they go hand in hand, and sometimes work with other physical therapists as well. So that was a surprise to me, because I thought that that's two separate things, and then I find out that it's actually very much related, even within the same profession, or you closely work with other physical therapists, with personal trainers. So let's talk about physical therapy specifically, because that's something that people may not realize that chiropractors do as well.
I'll let
Go
Dr.
ahead,
Todd
Doc.
go.
You want to take
You
the
sure
lead?
you want me
Yeah,
to go?
ahead.
Okay.
Yeah.
All right. So physical therapy privileges we do have in Maryland. So that opens up the scope of practice, what we can and can't do. And we can do a lot more in this state than others. And I don't think most patients realize that instead of just coming in and getting an adjustment only, so New York would be an example of that, patients are able to come in and we're able to walk them through anything from an acute episode of back pain or adhesive capsulitis, and then take them all the way to the endpoint, which can be sometimes returning patients to sport. So a soccer player, a basketball player having knee pain, for example, we're able to do a lot of good soft tissue work, a lot of assessments, a lot of functional screenings. I do with pretty much every athlete and almost every person that comes in. They're doing some sort of quarter squat or partial squat, but you're able to correlate whatever you're finding to what they need to make them stronger, as opposed to a cookie cutter, here's an adjustment, here's some stim, maybe an ice pack, heat, a roller table, and then they're out the door. So with the physical therapy, you're able to tailor what exactly they need, as opposed to just let's do some pelvic tilts and some stretching, because most people don't know, if you have a disc issue, a lot of times doing flexion-based stretches where you're reaching down, touching your toes, you're actually making yourself worse.
Right. I keep it really simple for folks when I'm explaining why we exercise. And at first, let's just preface it. If chiropractic is going to work for you, a lot of times you're going to get like glimmers of hope in like the first couple of visits. It's pretty obvious to a lot of people. And then to rehab you, yeah, that can take a period of time. But what I tell people a lot, guys, is I tell them, the chiropractic is think of it like we're a bricklayer. Chiropractic helps put those bricks in place, but the exercise is the mortar in between the bricks and helps solidify the adjustment. And also over time, which is amazing, what we're seeing is over time, if people are rehabbing and stabilizing, remember, a lot of times the bones go out of place or the bones fixate because the body lacks stability. And all of a sudden you give the person stability, dynamic motor control, you give them exercise to make themselves stronger. Now, all of a sudden, the need for those bones to subluxate, those bones to fixate, those joints to lock is no longer needed. So now with the adjustments go even easier. And the people think, oh, Todd, you guys are brilliant. The adjustments keep going easier and easier. I go, no, it's actually all the work you're doing. You guys are setting the stage. You're building this great stable structure. So the body no longer needs those fixations to protect it from the bad effects of gravity. So now that you're more stabilized, now you have more dynamic control. Now you're more posturally aware. The need for those bones to fixate, it's no longer needed. And with each adjustment, we can go deeper and deeper. And sometimes they get the deepest effects as they're the strongest, which is really funny for them to think. They go, oh, I thought I was going to get the biggest adjustment when I was most in pain. And a lot of times they get the best adjustment when they're the strongest and feeling good as they're finishing up care. So that's really neat to see.
Yeah, I love that you bring it up, Dr. Todd, because I remember when you were seeing patients who were a very, very acute type of case, maybe a disc issue, sciatica, and they cannot even walk. That's something that you would take very, very carefully and gradually under your care. And there are also some other modalities that you use as chiropractors that are also very, very helpful in that situation. For example, people may have no idea, but there is something called non-surgical spinal decompression. There is traction, there is cold laser, there is dry needling, there is Graston. There are many different types of treatment that an average person, unless they had some experience with that, they may have no idea about. But there is basically, imagine a toolbox. And in that toolbox, I think chiropractor has a lot of different tools to help achieve the outcome. And even if that tool that is needed is not in their own toolbox, I think the chiropractors, at least from my experience, are very much willing to call another friend who's going to be a medical doctor, who's going to have another toolbox and be able to help repair the issue even better, and then bounce back to the chiropractor to also make sure that the rehab goes very well. So I want people to be aware when we talk about chiropractors, what they actually do. This is what they do, and they do it not from time to time, but on a daily basis. Every single day you have different people that need different things, and you're able to juggle those problems and carefully assign with experience different type of modalities to each patient. So to me, this is art. I know it's science, and it is science, and there's tons of science about chiropractic, but to me it's also art. So I'm actually very happy to support your profession. And I wanted to ask you if there's something from those therapies, from those toolbox, if you would like to maybe, as an example, take one tool, maybe it's Graston, maybe it's spinal decompression, maybe it's laser, and maybe let's talk about one just as an example for patients to hear about. Dr. Neuer or Dr.
Yeah,
Todd?
okay. I wasn't sure who was going to talk first. One of the things I do a lot in the office is Graston, which is instrument-assisted soft tissue manipulation. So it's 6 stainless steel instruments, and they're designed to help what they term it a pro-inflammatory response. So it's designed to be some targeted soft tissue, and you're helping this is going to get boring, so I'll try to paraphrase. It's going to help the little cells that help, they're called fibroblasts, build tissues a little bit faster. One of the things they found is scar tissue kind of lays down in a spider web, and it can kind of tear and tear and tear and tear. And those are your people who say, I have to be careful. If I do this, X will flare up. It's generally not that tissue never healed. It actually keeps re-tearing the scar tissue. So with Graston and a little bit of rehab, and you appropriately load that tissue, you can actually get it to heal more parallel. So those are that's one of the things I use a lot in the office.
Yeah, that's a great technique, and we do Graston as well at the clinic. One of the other things I've noticed, Mike, and Dr. Neuer, you can comment on this, is I tried early on to, sometimes though chiropractors need to work on this more, is actually referring to other chiropractors. Sometimes we don't do that enough. Yeah, if people are moving out of state, some of us will reach out to other chiropractors or things like that. But I remember one time just calling every chiropractor in the Columbia area saying, hey, what's your specialty? If you're super good at something, I want to send people to you. And people are like, what kind of scam are you running? And I was like going, hey, if you're the best at it and you feel really good, I want to send people to you, man. And then, hey, if you're doing something great, maybe you can teach me a little bit of it. I'm gonna try that again. That'll be fun. But I think the thing I have the most fun with is what I just call, kinetic manual therapy. And what that is patients, they start to cue their muscles in certain ways of firing, and then we start to release either through mobilization, manipulation, the different soft tissue releases. A lot of times in the myofascial layer, I'm hanging out there. So working those adhesions that form between the muscle layers. I love the work out there, and release that while making people aware of their ability to pull those adhesions out themselves. So what we do is we're releasing that tension, and people go, oh, wow, if I posture differently, if I'm activating my cervicalis longus here while you're working on my hamstring, somehow that's connected. And I go, yeah, there's definitely a relationship between your deep neck flexors and your hamstring. And they're starting to realize that. Or they go, wait, when I engage my abdominal muscles, that allows me to pull my shoulder blades down, and that allows you to release my traps easier. So I love doing kinetic manual therapy, things where the patient is realizing how intricate the body is while we're doing it and making that. That's a really part. It's really important, I think, to step away from the passive modalities and move more towards these active modalities. And I think, Mike, what you're seeing, and Dr. Neuer, you can speak to this, is in chiropractic, we're starting to move away more from the massagey kind of things and more into active care. And as our population becomes more sedentary, I think we're, and moving less, chiropractic is required and to called upon to move actively. And chiropractic is heeding that message and going into more active care. Guys, as we finish up strong, what do y'all think about that as the future of chiropractic?
I love it. Yeah. I absolutely love it. That maybe Dr. Neuer will be able to tell us a little bit more from his perspective, but this is, I think this is it, because when we talk about active care, when we talk about care management, that's what patients need. Patients don't need you to do what you're good at and only that. Patients need what actually is needed. And I think a lot of old school type of practitioners will just treat everybody the same way. And that's why I wanted both of you to be on the call here, is because you both always customize. You both always care about what's best for the patient, not necessarily what I am the best at. So you look from the patient's perspective, and that active care with all the knowledge and experience and different modalities that you can offer, that you have in your toolbox, that nice combination just gives people a lot of comfort that when they see you, they're not going to have, just a quick adjustment, while that is helpful in itself, but they're going to be able to receive a more comprehensive approach from advice, evaluation, maybe even guiding them which blood work to order, and all the other things that I know are not maybe standard and typical, but they're still within your scope of practice that many, many patients, I guarantee, they have no idea about. Nutritional support, nutritional counseling. There are amazing doctors like Dr. Louis Crivelli, for example, expert in nutrition. And many people have no idea that a chiropractor could be the right provider to see for that. Dr. Neuer, what do you think?
Definitely, Mike. I agree. And, a lot of chiropractic begins with like the chiropractor acknowledging where the patient is, the patient accepting the chiropractic care, the chiropractor appreciating the differences of where the patient is and appreciating what the patients bring already into it, and then constantly assessing, like we talked, and then doing whatever skill you can to actively move that person forward. And there's so many modalities out of there. So a knowledgeable patient is great too. So it's great. And that's the wonderful thing, I think, and Dr. Neuer, you can speak to this, as patients are coming in with more knowledge than ever. And I love it. It's just absolutely great when patients come in and they are just like, hey, tell me about this. And sometimes they're like, no, we really don't need to do a coffee enema today, or something like that. Well, but you're like, okay, I could see what you're thinking. You're thinking cleansing. Okay, maybe we could think about cleansing. And let's talk about cleansing maybe through juicing, or hey, let's start cleansing through, the paleo diet or through, different diets. And Mike, we can talk about that as well. So there's other ways to get to that. And you go, oh, I see why you're asking it. Again, you reassess. Why are you asking this question? You acknowledge, you accept, and you move on. And hey, man, part of the art of chiropractic is injecting humor along the way to put people at ease, because humor is one of the best medicines we always have.
Absolutely. So I'm probably not going to say very much beyond what Dr. Todd already said, but I think one of the few things that our profession doesn't do well with is referring to other specialties that are within our scope. So a lot of peds and pregnancy, there's 2 or 3 people that are specialists in this area. I will always refer anybody who comes in with generally those questions to those providers. Nutrition is one of those things that I keep very slim as well, because that's not really my area of expertise. So I will constantly send people out for, if you really want a nutritional advice or weight loss. I have a personal trainer that I refer a lot of people to, and a nutritionist that I refer a lot of people to. But going back to that passive versus active in the WebMD, I have patients come in all the time say, I Googled my symptoms. I'm like, oh, here we go. But it's usually entertaining nonetheless. But I think there's been a massive shift for the passive to active. And the old school is usually rest, but rest is rust and motion is lotion. So you want to get people moving as much as you can, as fast as you can, to their tolerance. So I think that's one of the major shifts, is people know they shouldn't be in front of a computer. Ironically, we're doing this in front of a computer, but you shouldn't be stuck in front of a computer. You shouldn't be sitting for 8 hours, but you shouldn't be standing and running for 8 hours either. So finding that balance for each person is I think more important than most people give credit for.
Awesome.
Very good. Very good. And I really appreciate both of you jumping here for the call, because we have a nice conversation, but also it does help a lot of people just bring awareness what a chiropractor can help with, what they do. And I want to let everybody know is that now more than ever, it is more and more relevant. And that's because we are sitting down. And a lot of times we're switching from a maybe more comfortable chair in the office to our home office, and we may be working on a couch. We may be working at a dining room table or a different spot that we normally would be used to working. And then the back will sometimes remind us, but especially now with COVID, you're thinking, maybe I should handle everything myself. And that consulting approach is also very important, because I don't know if patients know, but they can actually call the office, do a virtual appointment with one of you, have a consultation, comment on Facebook if there is a problem. Should I use ice? Should I use heat? Well, you will ask a few questions. You'll be able to let them know what most likely would be better. If it's needed, you will invite them to your office. But that's something that I experienced a lot with chiropractors, that you're much more open to communication than maybe with some other professions that have 7 layers of assistance before you even get to somebody to help you. And that's something that I think it's underestimated in terms of the potential to get people better. And I really thank both of you for jumping on the call. We'll probably do part 2, part 3, and part 4 in the future, because there's a lot to say. But I really, really, really appreciate you. And for those of you watching, if you have any questions to Dr. Todd, Dr. Neuer, or any other providers in our network, comment below the video. Let us know. If you're an individual who is seeking clinical solutions, maybe you have gone to a doctor and you followed recommendations and you still don't feel better and you feel frustrated. That's why our group is here. We want to give you resources. So at least we give you hope that there are people who will collaborate to get you better, or to get your family member better. So definitely connect with us. Join our private doctors networking group on Facebook. Just search for Polish Your Life in the groups, and also follow us on YouTube, because as we produce those videos, we then edit, we put them on YouTube. We will have a very nice library that will serve you well. And also let us know, what would you like us to record about next? Who should we invite? Or if you're a provider, join us and then let us know what you do. We'll be happy to invite you to one of our conversations. So once again, thanks everybody here on the call, and thanks everybody watching. Take care. Good night.